Hello and welcome to another episode of Next Level Thursday. I am your host, Brian Hamrick, and I'm here today with Chad Creasey from RCB Associates. Chad, you have been helping me with my health insurance, my family and my own health insurance for, 10 years now, I think, ever since I went off on my own and left my W-2 job.
Thanks for having me.
Now, I thought that this would be a good time to talk because we are in an open enrollment period. And for those of our listeners or viewers who are responsible for getting their own health insurance because they don't have a W-2 job or someone else providing health insurance, there's a few things they need to know. So, Chad, why don't you fill us in on what people need to be aware of?
Sure. Thanks, Brian. Open enrollment is every year. It runs from November 1st to December 15th for January 1st effective dates. It also runs from December 16th to January 15th for a February 1st effective date. So for people who might have missed the early open enrollment, they've created an extension where they can continue to make changes in their plan, enroll in new coverage, or just get coverage because they didn't have it before.
Now, Chad, you've been helping me for years with my health insurance. Probably noticed that I'm really not that savvy on health insurance and all the different options and deductibles and HSA accounts and things I need to be aware of. How easy is it for someone to figure this out on their own? And when should they just give in and go to someone like yourself to figure out the best way to move forward?
I'm going to answer that question a couple of ways. The first thing that people should know is there is no cost to working with me. I don't layer on a cost for you. I get paid by the insurance company. So that's number one. One of the big pitfalls that I find, and I help a lot of my customers with, is making sure that they have their providers that they want to see available to them through the plan that they pick. That can always be a pitfall. There's some attractive rates out there, but then all of a sudden you're finding out that my doctor isn't participating. And when I go to my doctor, it's not a covered service. And now I'm out of pocket for that. So that's a big issue. Plan design can be a big issue too. Making sure that if I want to make an HSA contribution so that I can tax deduct my medical expenses, making sure I'm picking a proper plan allows me to do that so I avoid a tax issue later on. Normally, people only find out these trouble spots after the fact, after it's too late.
So what's your advice right now for people who are responsible for getting their own health insurance? We're in this open enrollment period. What do they need to make sure they do right away?
Talk to somebody who works with the health insurance marketplace. Make sure that they're licensed and certified to work on the health insurance marketplace, the Affordable Care Act, the ACA, Obamacare. A lot of people don't like the term Obamacare. But remember this, it isn't health insurance. It's rules and subsidies to help with the price of health insurance. You're still getting your health insurance from the health insurance carrier, not the federal government.
And Chad, the reason we're having this conversation right now is because we just wrapped up our annual health insurance coverage conversation. My wife was just here with me, and you helped show us how we could be saving or getting a subsidy of over $350 a month on our family's health insurance through the Obamacare or whatever the program is that we're leveraging. So that was very valuable. And thanks for sharing this information with our audience. Now, if anyone wanted to get a hold of you, how would they do so?
Phone number is 616-822-9286. That's my personal cell phone. We are on the web at www.rcbassociatesllc.com. You can fill out a request for a quote there as well.
Now, is it just people in Michigan who would benefit from talking with you, or do you cover other areas as well?
Well, because my daughter has now been working with me for 3 years and lives in Atlanta, we are licensed also in the state of Georgia.
Okay, so if you're in Georgia or Michigan and you are seeking help from a licensed healthcare broker to help you figure out what health insurance you should get for yourself and your family, definitely, Chad, I highly recommend you. And you're also a sponsor of the podcast. So thank you for that. And thank you for spending this time with us today.
Thank you. Appreciate it.